Hello and welcome to the latest episode with Asthma UK and the British Lung Foundation's in-house GP, Dr. Andy. In this episode, Dr. Andy will be discussing potential triggers around Christmas and New Year, and he'll also be giving you some useful tips for looking after your mental health now that we're in the darkest part of the year. Plus, he'll be telling you what breathing problems you should be looking out for and what to do if you're worried. As always, if this video helps you, please do let us know by leaving your comments, giving us a like, or subscribing to our channel today. And of course, if you feel able to and you find our health advice helpful, please do consider making a small donation today to help us continue defending the nation's lungs. Hi Andy.
Hello.
So with Christmas and New Year around the corner and people perhaps not in their usual routines, are there any symptom triggers people should watch out for?
You're absolutely right. This time of year, certainly in NHS, we see loads of people with different chest symptoms, especially if they've already got a lung condition. And there's lots of different reasons for that, because of course this time of year the weather's colder, people's got their central heating on, there's rotting leaves and vegetation out there, and of course there's viruses doing the rounds as well, and all those things can set people off. And then we move on to Christmas and the sort of things we see that set people off with their asthma or their COPD or other things. Sometimes it's their trees. So Christmas trees can bring in damp and mold into the building. People have got artificial trees, sometimes with dust on them, and same with decorations coming out the loft or cupboards after a year hidden away in there. And then of course there's things like candles and scents and things like that as well. And for some people that can be quite a significant trigger. So definitely worth bearing that in mind if you're entertaining people or if you go around to other people's houses. And then there's a celebration aspect as well. We're all prone to maybe overeating or eating the wrong things, over drinking, so having too much alcohol. And it's also a very emotional time of year. So some people get more excited around Christmas. And certainly in our household, it's very stressful at the moment, getting everything ready. And those things can all have an impact on our health and especially our lungs. But there are some things that people can do to sort of keep on top of it. Obviously, if you're aware of your triggers, you can try and reduce your contact with those things. If you're sort of looking after your lung condition, make sure you take preventer inhaler regularly as it's being prescribed and checking the inhaler techniques if you use an inhaler. And if you are getting any symptoms from your lung condition, then make sure you get help sooner rather than later, because these things are often easier to treat early rather than late. And on our websites, we've got a couple of pages which dedicate themselves to triggers at this time of year. And what we'll do is we'll share them in the links to this webinar so that people can go to that and read up a little bit more about the sorts of things that might upset their lungs this time of year and the sort of things they can do to try and keep well.
That's fab. Thanks, Andy. And now we're kind of fully in winter, and I think we just had the shortest day of the year. We know that people might be starting to feel the effects of that on their mood and how they feel. So what advice could you give to people who want to give their mental health and well-being a boost?
Well, you're absolutely right. Not everybody gets excited this time of year, or if they are excited, they're sometimes getting stressed about getting ready for Christmas and New Year and the holidays. And of course, COVID's starting to increase again, and that's making people's plans change and creating a lot of anxiety as well. And then when you pair that together with the shorter days, the bad weather, we're all feeling a little bit restricted. We've all got things that can bring our mood down, and we just need to bear that in mind, I think. So there's a few things that I advise people to do to try and prevent their mood sort of taking over. I mean, the first thing is trying to stay in a good routine, not just in terms of taking medications and things like that, but make sure you're getting enough rest, enough sleep, and enough time to relax without distractions such as your mobile phone or social media. I encourage people to make sure they're eating and drinking sensibly, not drinking too much. And it's a really good opportunity this time of year to give up smoking if you're a smoker. And that can have a big impact on your mental and your physical health. If you are struggling with all the things that need to be done this time of year, make plans, make lists, and concentrate on one job at a time, doing it well. And then you can actually see that you're ticking things off and making progress, rather than feeling overwhelmed with all the different things that we've got to do. And I think, as I say in pretty much every webinar, make sure you're getting enough exercise. It's obviously a positive thing for your physical health, but it's doing something, it's getting out of the house perhaps, or getting out of your routine, staying away from jobs. And actually it gets the endorphins going. And those are chemicals that help to counteract sort of low mood and things like that. So it can actually help to boost you as well. So make sure you are getting enough exercise to try and keep yourself ticking along. Something I think we all presume we do plenty of, but could just make more effort doing, that's connecting with other people. So actually having conversations and meeting, even on telephones or on Zoom or things like that, can help us to distract ourselves from all our stresses in life. It's something we can talk to people about, and it can be a really good way of actually boosting how we feel. Other things that you can do, I mean, there are a couple of brilliant websites. So Your Mind Matters, and there's NHS 111, which have got lots of links and support for you to try and help you, whether you're suffering with stress or low mood or anxiety or anything else. And if those things really aren't helping or you need extra help, then don't forget your GP is there. We're very used to dealing with these sorts of things, and it might just be a question of pushing you in the right direction, giving you the right advice to look after yourself. But of course, we've got access to counselling and other support services and even medication if that's needed. So there's plenty that we can offer on top of all those other things you can do to hopefully help yourself.
And we've also been seeing an increase in calls to our helpline from people asking what to do if they or even their child starts experiencing breathing difficulties. So, what breathing problems should people be looking out for, and what should they do if they're worried?
Well, first thing to say is that chest symptoms are very common, and that chest symptoms include sort of coughing, wheezing, breathlessness, and it can be very scary for people, for the child, but also the people looking after them as well. But the important thing to remember is there are so many different things that can cause these chest symptoms. I mean, for example, having no symptoms from having a cold or even something like hay fever. That in itself can cause people to have a cough and sometimes even go on and trigger things like wheezing. So the smaller the airways, so children tend to more likely to have a wheeze or have sounds on their chest even when they're not particularly unwell with it. And a little bit of mucus in the airways can really make the whole lungs and the whole chest sound very, very rattly. And quite often that sort of clears when people either change position or cough. The sort of things I tell parents to look out for are firstly use their own instincts. So if they're worried about their child or their child doesn't seem well or there's something they just can't put their finger on, then don't be afraid of asking for help. You know your child better than anybody else. And even though there might not be something seriously wrong with them, if you're worried, then it's best to talk to somebody to make sure we're not missing something else. Other things to look out for. So if your child isn't feeding well or they're getting signs of dehydration, so especially if they're not passing urine, if they're working hard to breathe or they're breathing faster than normal, or they're using what we call the accessory muscles, they're muscles of the neck and the stomach to help them breathe. And that sometimes causes them to suck in under their ribs as well. That's something to sort of keep an eye open for. If your child's not quite themselves, so they're drowsy or hard to wake, again, that's something to worry about. And something I think everybody sort of knows, but just to sort of point out, if your child particularly the skin's turning blue or very pale, or they're getting sort of blue on the inside of their lips or on their tongue, then that's a sign that they need urgent help as well. So make sure you speak to somebody. So there's lots of different things to sort of keep your eyes open for. There is a superb website that's worth having a look at, not just for sort of chest infections and chest symptoms, but lots of other childhood issues as well. And we'll put a link in that as well. It's a Healthier Together website. And actually something that we've been working on with Asthma UK and British Lung Foundation recently. And we're actually hosting on our British Lung Foundation website some pages on bronchiolitis. And if you haven't heard about bronchiolitis, it's one of the most common chest infections affecting younger children. And our website has got lots of details to help support the NHS and parents of children who might have bronchiolitis to deal with what we call respiratory syncytial virus, RSV. And it tells you about the condition. It tells you the symptoms to look out for. It tells you what symptoms to worry about and when to seek help. And then also the sort of treatments that we might consider if the child is particularly unwell with bronchiolitis. So there's lots of information on there to support you if you've heard about bronchiolitis, if your child's got bronchiolitis, or if it's just something you just want to know more about. So if you can put a link on this webinar for people for that one as well, that'd be really important for people to go and have a look at and learn more about that condition and get help for if their child is suffering at all.
That's great. Lots of really, really useful information there, Andy. Thank you. So I'm just going to pause just to say that, of course, all our advice is correct at the time of filming. And please do check out the links in the description below for the latest updates from Asthma UK and the British Lung Foundation. And of course, if you're enjoying what we're talking about, please do let us know. Leave us your comments, like the video, or you can subscribe to our channel today. Now, Andy, at this time of year, we usually see the numbers of people catching flu increase. So how can people with lung conditions protect themselves and others from the flu?
Well, not just flu, but all sorts of viruses are doing the rounds at the moment. There seems to be some particularly nasty sort of common colds going around and causing people a lot of problems with their upper respiratory tracts, that's their nose and throat, but also their chest and their respiratory conditions as well. So, like COVID, flu spreads in the air from person to person, and it can also spread from contact as well. So, the sort of things I advise are, if you have a cold or flu, don't spread it, don't go around, and certainly don't go into groups and people who are more vulnerable. Make sure you practice good hygiene, so lots of hand washing and use of soap or sanitizers to make sure that you're not carrying any of those germs on your hands. If you are sneezing or blowing your nose, make sure you sort of throw away the tissues immediately and wash your hands afterwards as well. Consider wearing masks, especially if you are going out and about and into enclosed spaces, because that again can stop the bugs from spreading. To avoid catching sort of flu and other viruses, avoid busy indoor enclosed spaces and mixing with people who you don't normally mix with. They could well be carrying these bugs and not know it themselves. So the more people that are around you, the more chance there is of you catching it. Certainly the big thing that we're doing in general practice at the moment is we're doing lots and lots of flu jabs. And the flu jab is really important because firstly, it stops you catching it, it stops you spreading it, and it also reduces severity if you were to catch it. So it's protecting you, it's protecting the people around you, and it's helping to protect the NHS as well from being overwhelmed anymore this winter. If you haven't had your flu jab yet and you've got a lung condition, speak to your GP or your local pharmacist, and I'm sure they'll be able to book you in or tell you how you can get your flu jab. And of course, one thing that you can do to help reduce the effect of any viruses such as the flu on your chest is look after your lungs. So if you are on preventive medication, make sure you're taking it regularly. Make sure you've had your inhaler technique checked if you use inhalers. Follow your asthma action plan or your self-management plan if you've got another lung condition. And make sure you get early help and advice if you are struggling with new or worsening lung symptoms. And some other simple things like making sure you're eating and drinking well, getting enough exercise, and stopping smoking. You're more likely to catch flu if you're a smoker or around people who smoke regularly, so make sure that you are cutting down exposure to tobacco smoke as much as you can. So there's some simple things in there, perhaps some more difficult things in there, but I think at the moment the big priority is people making sure that they try not to spread the infection or put themselves at risk, and getting the flu jab as quickly as you can.
That's amazing. Thank you so much, Andy.
Thank you.
Thank you so much for watching today's Q&A with Dr. Andy, brought to you by Asthma UK and the British Lung Foundation. If you found what we've been discussing today useful, please do like the video, comment and subscribe to our channels today. As mentioned, you'll find lots of useful links in the description below, and if you feel able to and you find our health advice useful, please do consider making a small donation today to help us continue defending the nation's lungs.